I am both a board-certified pediatric pulmonologist, but I'm also a board-certified sleep medicine physician. And so because of that, in my practice, I have gained quite a bit of experience about sleep issues related to patients with and caregivers with SMA. And unfortunately, like many aspects of healthcare with SMA, there's not a lot of literature about this, and there's a lot of under awareness about sleep issues related to SMA, both to individuals with SMA and to caregivers. And I think there's also a this lack of information and education leads to a lack of diagnosis and treatment. And so the issues about sleep are both the more classically known, which is respiratory issues related to sleep, and then the non-respiratory issues, which actually are harder to treat. So most individuals who know about SMA know that SMA can be associated with breathing issues when individuals sleep at night. So maybe during the day they don't have an obvious problem, or they don't have a problem with breathing, but at night they have a problem with breathing, which can be very subtle, such as snoring, to issues such as true obstructive sleep apnea, where there are periods where they either have insufficient breaths, which are called hypopneas, which result in a physiologic change, which either is an arousal, or meaning you're waking up from sleep, you're fragmenting your sleep, or a change in your, usually a decrease in your oxygen level, or an increase in your carbon monoxide level, or probably also changes in your heart rate. And those are the issues that are more known, and so those are ones that we try to treat with interventions such as good airway clearance, and sometimes the addition of usually non-invasive assisted ventilation or bilevel positive airway pressure. And what we think is by helping workup breathing, then we help and help obstructive breathing, then we help with sleep fragmentation, so you have better quality sleep as well. And you also have normalization of your oxygen and your carbon monoxide levels, so that improves weight gain, neurocognitive development, systemic total body improvement. But the other issues about sleep in SMA individuals and their caregivers that it's less known about is sleep quality. And there have been some studies about sleep quality in individuals and in caregivers with other chronic conditions, like individuals with cystic fibrosis or individuals with other neuromuscular disorders, like Duchenne's muscular dystrophy. And what we find is that in those individuals that sleep quality is not as good for a variety of reasons. And even more significantly is sleep quality is really bad in the caregivers. And that poor sleep quality in the caregivers results in poor health, both emotional and physiological in the caregivers, which is very important. And I think that there needs to be a lot more awareness and research into this particular field of sleep-related issues in both individuals with SMA and their caregivers. In my personal experience, I want to say that I became 1,000 times a better physician and probably a person when I had my own kids. And learning about sleep and the importance of sleep for my children as well as for the family. And what I realized is, and this is what every parent knows, is if your child can't sleep, then you don't get any sleep. And fragmented sleep or poor sleep is a leading contributor to poor health in the parent, which leads toward possibly higher utilization of health care in the individual, and then problems with work and in some cases school absenteeism. So sleep problems have a a sleep problem in a child and in a caregiver affects more than just this one unit. It has like global implications. And what I want to say about the sleep in caregivers is that individuals with SMA have many reasons why they can't sleep well. As a pulmonologist, my main thought always is related to breathing issues. But really, a lot of individuals with SMA can't sleep because of other issues related to pain and mobility and positioning issues, and that fragments sleep. And before I had children, I had a very good idea about what the impact of sleep fragmentation is on myself as an individual, because as my experience as a medical student and as a resident and as a fellow of getting paged throughout the night, where you finally get to sleep and then you get a page and then you have to answer it, and then you try to go back to sleep and then you get a page again. And this disrupted sleep really affects daytime performance and mood. So there's a big impact on there's a lot of literature about sleep fragmentation and its impact on health, on mood and performance. And there's some very interesting studies about sleep deprivation and what that means to an individual, and how it's detrimental. And so for the caregivers of patients with SMA, sleep fragmentation is, I think, a very big issue and one that's cumulative. You start up with a sleep debt which you never recover from, and it affects your daytime ability to perform, and it will affect your emotional well-being and your own health status. And that's why we try, and it's very important that for the patients I see, that when I prescribe an intervention, that I take into effect, that I take the impact of how this intervention will affect sleep, so both the caregiver and the patient. So my minimal goal is that someone hopefully not need an intervention for at least 6 hours. So that means then hopefully that both the patient and the caregiver will get at least 4 hours of non-interrupted sleep. And 4 hours may not seem a lot, but for some people that 4 hours is the only 4 hours of non-interrupted sleep they're going to get.